Okay, good afternoon. Today I'll be discussing low-calorie sweeteners and body weight and composition, a meta-analysis of randomized controlled trials and prospective cohorts. Before beginning, I'd like to acknowledge my co-investigator, Dr. Paige E. Miller, who is now with the Edward Hines Jr. VA Hospital in Illinois, and our funding source, the North American branch of the International Life Sciences Institute. The content of this work is solely the responsibility of the authors and does not necessarily represent the official views of ILSI North America or any other organization or agency. So in today's talk, I will go over a brief introduction of the issue and the study objective, the methods used for our meta-analysis. I'll focus on the results and the summary of findings, address current research gaps that were identified and research recommendations, and end with concluding comments. Overweight and obesity prevalence remain markedly high worldwide and constitute the 5th leading risk factor for global mortality. Overweight and obesity-related health conditions include cardiovascular disease, type 2 diabetes, some types of cancer, and some of the principal causes of preventable death. Strategies to help prevent overweight and obesity include achieving and maintaining a healthy weight, exercise, and other lifestyle behavioral changes. The replacement of caloric sweeteners with lower or no calorie alternatives is one strategy that may facilitate weight loss or weight maintenance by helping to reduce energy intake. Low-calorie sweeteners may improve adherence to weight loss or maintenance plans by preserving the palatability of foods and beverages with fewer calories than sugar. However, conflicting findings on LCS and body weight in the literature have led to recent scientific consensus reports stating that the evidence on the relationship between LCS and body weight is inconclusive. As a result, we aimed to systematically review and quantitatively assess the results from randomized controlled trials and prospective observational cohort studies separately that examined the relationship between LCS and body weight, fat mass, BMI, and waist circumference. To do this, we conducted a systematic literature search through September 16 of last year, and the goal was to identify RCTs and prospective observational cohort studies examining LCS intake from foods or beverages, or LCS consumed as tabletop sweeteners that are approved for use globally. The inclusion criteria consisted of generally healthy study populations, the availability of dose or intake data for at least one LCS or delivery vehicle of LCS, the ability to examine the effect of LCS compared to the control arm, independently of other intervention components, the availability of outcome data for at least one measure of body weight or composition, and a minimum study duration of 2 weeks for RCTs and 6 months for prospective cohorts to be consistent with existing literature. Studies of non-approved sweeteners or sweeteners providing energy equal or above that of carbohydrates were excluded. For the RCTs, we conducted random effects meta-analysis to examine the mean change in body weight and composition between the LCS intervention and comparator groups. Subgroup analyses consisted of analysis by age, by sex, by the source of LCS, and whether or not the LCS intervention resulted in significantly lower energy intake compared to the comparator arm. 2 or more RCTs by outcome were required to generate weighted group mean differences and measures of variability and heterogeneity. For the observational studies, the analysis was largely the same. However, we conducted random effects modeling of reported or calculated t-statistics, which allowed for the synthesis of the regression slopes based on a standardized metric. Subgroup analyses were conducted as done for the RCTs if possible, and according to whether these studies controlled for total energy at baseline and baseline measures for body weight and composition. Again, 2 or more studies were needed to generate weighted group mean correlations and measures of variability and heterogeneity. We examined publication bias both visually and statistically using funnel plots and Egger's regression test. We used PubMed for our search engine of choice, and we identified 522 articles from our initial PubMed query. On the basis of our inclusion and exclusion criteria, we identified 15 RCTs for inclusion in the meta-analysis and 9 prospective observational cohorts for inclusion in the meta-analysis. So for those of you in the room who may not be familiar with forest plots, so what we're looking at here are the effect estimates represented by these squares across all the studies. These are randomized controlled trials that looked at body weight. This vertical line here in the middle would indicate no significant difference in body weight reduction between the intervention and control groups. Any effect estimate, such as this one, that falls to the right of the zero would indicate that the mean change in body weight, or the mean reduction in body weight from baseline to follow-up, was greater in the control group than in the intervention. And any effect estimate on this side of the zero would indicate the opposite, that the intervention resulted in a greater mean reduction compared to the control. So what we see here is looking at LCS intake and the effect of intake on body weight in the randomized controlled trials. We see that the LCS intervention resulted in a 0.8 kilogram reduction in body weight. Looking at the effect of LCS intake on body weight by age, we found statistically significant associations among both adult and children populations. For adults, we observed a 0.72 kilogram reduction in body weight, and for children, it was a 1.06 kilogram reduction. Looking at the analysis by men and women, we found that the effect of LCS intake on body weight for women resulted in a statistically significant reduction of 0.72 kilograms. And for males, we saw a 0.09 kilogram reduction in body weight. Looking at the source of LCS, we had enough data to look at LCS administered through beverages only and LCS that was administered via a combination of beverages, foods, and supplements. And what we saw was a significant reduction in the analysis of only beverages, and we also saw a reduction in the analysis of LCS administered as beverages, foods, and supplements. Looking at the effects of LCS on the other measures of body fatness in the randomized controlled trials, we observed statistically significant reductions for BMI, fat mass, and waist circumference. These were all statistically significant. Moving on to the observational studies, we observed no significant associations between LCS intake and body weight and fat mass. We did, however, observe a slightly higher BMI associated with LCS intake at baseline. And the overall pooled estimate was slightly attenuated when looking at studies that adjusted for total energy intake or baseline BMI at baseline. Looking at publication bias, we had enough data, or the largest set of data came from the body weight analyses. And what we found from this funnel plot was no evidence of statistical evidence of publication bias in this analysis, which was supported by our analysis of Egger's regression test. In our analysis of the cohort studies, we identified some statistical evidence of publication bias based on our visual assessment of the funnel plot, and this, however, was not supported by our analysis of Egger's regression test. So to summarize our main findings, the meta-analysis of 15 RCTs, which is the gold standard study design in medical research, showed that LCS intake resulted in statistically significant reductions in body weight, BMI, fat mass, and waist circumference. The results from the observational cohort studies showed that LCS intake was not associated with body weight or fat mass, but was significantly associated with slightly higher BMI. We identified from the studies included in our review limited information into specific LCS, so we couldn't look at polyols or any other type of LCS and its effect on body weight and composition. Few studies provided separate estimates for men and women, therefore limiting our evaluation of sex-specific effects. The observational studies were limited in their dietary assessment methods, among other methodological limitations, and future studies that utilize new and improved dietary assessment tools can potentially improve the quality and validity of dietary intake data, and thus studies that depend on these observational data. And research into the role of LCS as part of overall dietary patterns would provide important insight for developing guidelines and public health recommendations. So in conclusion, the present meta-analysis is the most comprehensive scientific evaluation of LCS and body weight and composition to date. The study directly compares the results from RCTs and prospective observational cohort studies, which addresses the statement that the findings on LCS and body weight are inconclusive. Cautious interpretation of the findings from the observational studies reviewed is warranted based on a number of methodological limitations. And the data from RCTs, which provide the highest quality of evidence for examining the potentially causal effects of LCS intake, indicate that substituting LCS options for their regular calorie versions results in a modest weight loss and may be a useful dietary tool to improve compliance with weight loss or weight maintenance plans. Thank you.